Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, dear listeners, to another talk show on Muslim Television Ahmadiyya, MTA Gambia. We have for you today two guests who are going to talk to us about the coronavirus in relation to mental health and our psychological well-being. Today with me, I have our guest, Mr. Sajo Kamara, who is the principal psychiatric nurse in West Coast region. And next to him, we have Fatmata Jallo, Mental Health Information Office at the Ministry of Health. Please, can you kindly introduce yourself and tell us what you do? What does your work entail?
Yes, Assalamu alaikum rahmatullah to the viewers and welcome to our program. To Mr. Ba, thank you. It's been a pleasure to be here. Like you rightly said, I am Sajo Kamara, a principal psychiatric nurse at the Western Region 1. My job entails assessment and treatment of patients who have psychological or mental ill health problems, coupling with addiction in some regards and sometimes med-surg problems, because at times we do run into issues in relation to medical health comorbid with medical surgical problems. And these things, unless you manage them simultaneously together, one might not improve over the other. So we do have these problems and we deal with some, but essentially I am to do the mental health aspect of the job.
Thank you. Fat Jallo, can you tell us about yourself, your work?
Okay, thank you, Mr. Ba, for having us here today. My name is Fatmata Jallo, as you rightly said, and I am the Mental Health Information Officer at the Ministry of Health. Mostly what my job entails is like informing the public about mental health issues in the Gambia, educating them and sensitizing them about mental health. Mostly I do this maybe on radios and on TVs and in public places, maybe schools and other stuff. And also I also serve as an advocate for the mentally ill people.
Thank you very much. Safe to say, therefore, that we are in good hands, dear viewers. Please let us pay attention to what our experts have to tell us about this COVID-19 and our mental health. To begin with, Fat Jallo, let us begin with you. We are facing a pandemic in the world today, COVID-19. Currently, we know that there are more than 1 million cases. In fact, more than 1.25 million cases in the world. Does COVID-19 have any effect on our psychological health or well-being?
Oh, thank you very much, Mr. Ba, for asking that question. Yes, indeed, it does have a psychological effect on us. Because when you look at it, you being confined at one place, not going out to do your normal routine in life, it's going to have impact on you. You see, by this time, most people right now, they are stressed, worried, they have anxiety, they are depressed, they are panicking, they are fearful. All of these things are there. Because it's a pandemic, as they rightly say, it's a pandemic and people are worried. Am I going to have this condition? Is my family member going to have this condition? If I'm confined at one place, how can I go and get livelihood for my family? All these things are causing problems in us. People are talking about maybe the preventive part of like how to prevent yourself from getting this condition. But mostly people don't, it's just now that people are trying to come up and understand that yes, indeed this thing is causing problem in us. It's causing most problems in us, because if you look at it, there was one time in the news that people are committing suicides because of this. Yes, most of their family members had died. They don't have anything to eat in their home. So it's causing a lot of problems in them, and they are having psychological problems or mental health problems. It is indeed causing psychological problems in us.
That's right. If I get that right, it means that even the fear itself, it's some form of anxiety which can cause a mental breakdown or something like that. So do you have anything to add to that,
Yes,
Mr. Kamara?
Mr. Ba, just to throw some light on that issue. I think there's a great deal of issues when it comes to new outbreaks, such as this COVID-19 pandemic, which is a massive outbreak in the world today. Almost all over the world, people are scared, people are living in fear, in worries, in constant anxiety and all of that. So you don't know what really is going to happen. Is that the issue why we have been dreaded and being terrified is because no one really understands what is happening. These things are developing, new information will come along the line until when we are certain that this is what we are dealing with. So that being the case, new issues in our lives will bring in some worries, and that develops. If we do not have mechanisms in place that will help us manage those things, we can run into depression and all the great psychological breakdown that we can suffer. We don't pray for that, but these issues that cause constant anxiety and dread in people can cause some people to develop mental ill health problems like post-traumatic stress disorders and the like, stress, chronic stress, anxiety, and generalized anxiety, which can give you constant worries all over your surrounding, even if you do know that you don't have adequate control over issues, but you are in constant threat and worry. So this issue of a pandemic outbreak in COVID-19 has really affected our mentality in so much negative ways.
Yeah, I am sure that is true, but also I think the other angle which also should be highlighted is the constant flow of information, sometimes contradictory information on the internet, on television, on social media. Everyone is talking about mental disorder, not mental disorder, but coronavirus or COVID-19. Can this have an impact also on the psychology of the people?
Well, if I can say it this way, I wouldn't like to call it contradictory information or whatsoever. I think there are new developments coming. So if you're dealing with something that is new, that no one has ever seen per se, most people who live in the world today have never experienced such a massive outbreak as COVID-19 in concern today. So things will come up, information will develop, because there are constant studies, scientists are studying in order to understand what really is happening, because no one is sure of what is happening. And that's why the treatment and management measures are just based on symptomatic and manifestations that someone suffering from this condition will present. But of course, there will be information, and what we can do to help our own psychological well-being will depend on where we pick information from, the sources where we depend on to take information from. Of course, there are many outlets, media outlets, whatever, in the internet, over the radio, television, where you will hear of information regarding this pandemic, but not every information is authentic. So we do need to understand where we take our information from. One key area or two that we can depend on is within the country where you find yourself, the health police or the health ministry. You can depend on them to get reliable information within that environment. If you want to understand the extended wise globally, you can depend on WHO, which is so reliable. Whatsoever information they might be sharing with the public might be the truth at the time. Of course, there can be new information that will develop to come up, but whatever they say at the time is expected to be the truth. So when new informations come, they will give you the new information. That would entail that they're contradictory, but instead, because we are developing, we are wanting to know more about what is happening, so we'll tend to bring in some more new relevant information.
That's good. Yes, Fajal, of course, we know up to this time that there's no cure for the coronavirus. Also, there's no vaccine, which takes us back, therefore, to prevention. What does someone do to prevent yourself from getting not about the coronavirus, but mental problem due to the bombardment of information and fear from this coronavirus?
Okay, there are some tips that you can follow to help you manage your stress level or to help you manage your worry level. So the first of all is you connect with people. Connect with your loved ones, connect with your family, or connect with your friends. You being in isolation or you being in self-quarantine doesn't mean that you have to stop all form of communication. That will have more impact on you. Connect with them either through social media, emailing, or other forms. That will really help you, because if you know what they are up to or how their situation is, your mind will be at ease and you will not worry. That one helps. Also, it says that you should also be on top of things, meaning you should know what you should do to help yourself. For example, like you are home, maybe your boss asks you to work from home. Like you need all the stuffs that you need to work from home to be with you. And also you stock yourself maybe in food-wise or in drink-wise. You have all those things at your home. Also, another form also to be able to stop yourself from worrying or stress is to limit yourself, like in watching the news or looking out for information about the COVID-19. Always, if you keep on looking at breaking news, always, you'll be more worried. Like they say, you set a particular time, maybe let's say every hour or every 2 hours or every 5 hours, I'm going to look at the news to see what is developing. Not always constantly, you are streaming news, they are streaming news. It's gonna help, it's gonna make you more worried. And also, you should look at sites, as Sayo rightly said, that are reliable in giving information. That is the ministry that you are, the country you are in, and WHO. Those people give reliable information. Also, what you can also do to help yourself is like you maintain physical exercise. Because when you are sitting there at home, always thinking without doing anything, it's going to have effects on you. So it's very good you exercise. Maybe you follow the normal routines that you used to follow before the outbreak, or you develop new ones that helps. Also, it says like you sleep. It doesn't mean you have to sleep the whole day because you are in self-isolation or you're at home. You have to have limits. If you used to sleep 7 hours or 8 hours, you do that. You sleep 7 hours, you sleep, or you sleep 8 hours. It doesn't necessarily mean you have to sleep all day or you sleep less days. So those are some of the tips that you can help yourself. Okay. To help yourself in managing your stress level.
Okay, that's good. Yes, Sadio, do you have...
coming to the preventive measures regarding how we help our mental well-being and psychological status as far as this COVID-19 is concerned. I think she said brilliant points that someone can look up to. Absorbing into this COVID-19 will do you more harm than good. We need to be limited how we absorb the information. You don't need to overflow with information. You just need to get what is relevant at the time in order to help prevent your own self and your surrounding family members, extended relatives and friends as well. So I think maintaining your routines, like if you do exercise, everyone really do need exercise in our lives to improve our mental well-being. Even aside from any outbreak, aside from any new occurrences in the normal standard of our lives, we all do need some form of exercise to improve our health and our general mental well-being. So we need to maintain those things and keep in contact with our families and all of those things who make us really to understand that we are human beings and we are complete in our society. One key thing that is important in these massive outbreaks as COVID-19 is extending our hands to people in kind, in physical help, whatsoever way you can help people. In as much as you make them happy by helping them, you yourself gain the feeling of being complete, being useful in society. Like you are helping people and you can see them smile. Putting a smile on people's face have a positive impact on the one who is doing it as much as the one who receives those things. Yeah, so
in short, that is a form of socializing in isolation. Even though you are in isolation, you still socialize, reach out to people, talk to your loved ones and stuff like that. But we know, of course, we are being restricted, being told that we should maintain social distance. So, but the use of technology here will be very important. You can call your loved ones, you can talk to them on Skype or stuff like that, because in that way you will keep in touch and still be...
Mustafa, if I can come in, one thing that we overshadow, we don't tend to pay attention to, is we do not necessarily need to talk to people all the time. Sometimes some problems only need you to be there, just to be by my side, to understand that there is someone by my side who can listen to my worries. Maybe I just need to vent out my frustration onto someone who will understand my status at the time. So just by being the side of someone who suffers from this problem and just listening to what they're saying to vent out their frustrations and troubles can help people very, very well. So we don't need to call people all the time to just be talking, but sometimes we only call to listen to what problems they have. If we could help, we can. If we can link them to any service that can help them out from that situation they find themselves, that'll be really helpful.
That is good. But we know that the brunt of the COVID-19 worry is on everybody, of course, but more so the frontline workers, the health officers, the nurses and doctors who are always out there trying to help people, test people and stuff. So how can these health workers take care of their own mental well-being while doing this work, reaching out to people, testing people, treating people? At the same time, there will be, of course, psychological impacts on them. What can they do?
Yeah, I think coupled with the things that the whole population might be doing to help themselves, to protect themselves, all health workers will be doing those things as well. Of course, we might not be able to stay at home. We need to be on the front line. But the diet aspect, the water, to stay hydrated, to do your normal routines, as to maintain your exercise routines, and limit the amount of information you will absorb from the media, and to stay up to date with relevant information will help all health workers in this regard. But one thing I would say, I don't know if I could say it this way, but sometimes health workers tend to be naive of themselves. We tend to pay so much attention to those we are helping and then put ourselves into spots that are difficult for us to get ourselves away from. And that's why many times we'll be infected with all of this, because we think we necessarily need to change every situation that we come across. And that's not the essence. Of course, it's difficult to tell that we cannot change every situation that we come across, because we really cannot. We don't have that power. Sometimes we need to understand the fact and to accept the existence of the fact that we will leave some people to die, but we don't need to absorb ourselves into those matters. It will be difficult to see someone you want to help to come alive, and all of a sudden you see him or her dying. That's a difficult state we all need to understand. But we need to relieve ourselves from those effects. We need to live into new lives in order to stay healthy and to be able to help other people as well. So when we need to rest as a healthcare worker, we don't need to be naive of that. We need the time to sleep, to rest, and to get every other odd information that we absorb all the day. Being in this front line is so stressful. I have a first experience to be on the front line to help people who come into the country, to quarantine them. But you will hear all sorts of words unto you, and you need to absorb this and manage. So there are a lot of things that you will come across during the day, and you need to sleep this off so that tomorrow you can be useful by yourself and to help other people. If we do not maintain this cycle in our lives, we will end up being broken down. And if we cannot help people, what's the essence now again? So we need to pay attention to ourselves.
That's right. Fatmata, you want to say something? After that, we'll go to the VT.
Okay, I want to add more light on that. Okay, like healthcare workers, as Sajirati said, you as a person, you need to know when you are at the point of burnt out, or when you are at the point of being overwhelmed. Like, because this is a new pandemic, as Sajirati said. People are overwhelmed. Hospitals are overwhelmed. You have more people coming in than it was usual. So you'll be overwhelmed. Sometimes when you are overwhelmed, you'll be burnt out. You yourself, you will realize that I need rest, but you still want to go on. It's not good for you. When you know that you need rest, you need to rest. Because or else, as they say, you will snap. You will be at your breaking point. And when that happens, you yourself, you will be sick, and you cannot help those people that you want to help. But you'll be on your sick bed. So understand when you are at your breaking point that you need to stop and I rest. I can help people, but not to the extent that I have to harm myself.
That's right.
Yes.
Dear viewers, we'll go for a short VT, a short video, which will throw light on what we are discussing, and then we'll come right back to the studio and continue this discussion.
More than 100 doctors and nurses have died worldwide from the coronavirus. Hospitals are reaching breaking point across many countries as people who are not heeding the advice of governments to protect themselves are flooding clinics and hospitals.
With the constant disparities and pain and suffering that we see, not only with those who are afflicted with the coronavirus, it's been like a war zone, a medical war zone.
This right here is my N95 mask that I will be wearing for the whole day throughout my shift. These, it's one form of eye protection to protect your eyes from splashes. This is what I'll be wearing generally throughout the day if I need to go into a high-risk procedure. This is our ED. You can see all the rooms are filled. Usually these halls are very neat and empty. And now you can see there's patients everywhere because of this. It makes it very hard to work, and we're trying our best to treat everyone that we can. All these patients here. Even though we're overflowing, we're trying our best to still provide them care, which we are doing.
So currently COVID-19 does not have a curative medicine. The only thing we do is called supportive care. And what that means is we fix what we can. So if the patient's levels of blood oxygen is too low, we give them more oxygen. And if they are not able to get enough oxygen into their blood without the support of a ventilator, then we put them on a ventilator, provided they meet particular criteria. And if despite that they do not recover, then really we've done the best we can because, as I said, at the moment there is no curative medicine or treatment for COVID-19.
So at the minute we've breached our capacity in intensive care, so we've got over 16 patients now in intensive care. Normal capacity will be 13 ventilated patients.
As healthcare workers get infected themselves, this places an additional load on services as they are taken out of rotation to recover.
We can't take care of you if we can't take care of ourselves. So I think a lot of us have accepted the fact that, you know, we're probably going to get this. It's just, we want to survive, you know. We're all being exposed to it at some point.
So we were told that our normal rotas have been abolished. We are doing long days and nights, which are 13 hours each. There is no other shift.
The things that I see in the ER are scary. I'm a little scared myself. I'm tired. I'm gonna go home.
Oftentimes, before I start my shift, I have to pray and meditate for at least 5 minutes to get my mind in the setting of going into this war that we're battling, which is the novel strain of the coronavirus. We're trying to keep our head above water without drowning. We are scared. We're trying to fight for everyone else's life, but we're also fighting for our lives as well. It's tough. And many shifts that I've left from, after finishing my shift, I've cried.
I've welled up in tears at times, you know, when we take somebody's loved one out of their home. Nobody's allowed to go with the patients as opposed to before. They would have a family member that could come. Oftentimes we know that they will never see them again alive. And these people will most likely die in a bed alone. It's profound sadness.
We've seen teenagers die. We've seen people in their 20s and 30s. I have seen people in their 30s die who were fit and well and had no medical problems. You know, that could be me, that could be a relative, that could be you. So don't take this illness for granted. This is not a mild illness. This is not the common cold or the flu. This is something much, much more severe, and it's an illness against which we have nothing. So stay at home.
We still desperately need your help. The only way to stop the spread of this virus is to stay home.
But I can't emphasize to you how sick this can make you. Please, please listen to the advice that's going around.
Welcome back to the studios here on Muslim Television Ahmadiyya, the Gambia MTA. We are discussing the coronavirus, its effects on our mental health and psychological well-being. And with us here we have Mr. Sadio Kamara and Ms. Fatmata Jallo, who are discussing these issues with us. Like we had in that video, we have heard of fear, we have had anxiety, we have heard of the fear that the people themselves who are working to protect people or treat people are going through. Now, obviously, this will have an impact on how we relate to the people who were either sick or now have been discharged. How do we prevent stigma related to this coronavirus?
Okay. Thank you very much, Mr. Ba. Stigma is likely and discrimination is likely to happen after you have the COVID-19, maybe your family member or yourself as a patient. What people need to understand is this virus does not only affect people of a particular nationality or an ethnicity. It can affect everybody. So people need to understand that. And also, it doesn't mean that when you have the virus, you did something wrong or you are guilty of something, that's why you get the virus. People need to understand that as well. People who got the virus did nothing wrong. It's just that they were the one who contacted the virus. Anybody can. It can be either be you, it can be me. We are not all exempted. We are not immune to it. So people need to understand that when they come out, or when the person have COVID-19 and you recover, you come back to the society. People should not discriminate against you or start calling you names like the COVID-19 case or the COVID-19 family. It's going to have impact on you. You're going to have maybe, as I just said, post-traumatic syndromes or stresses or depressions. People need to understand that. It's our collective responsibility as a society to see these people that they've contracted a disease, they are fine and they are home. It doesn't necessarily mean that they're gonna be living with that disease for the rest of their life because they are cured or they are better. We need to put them back into our society. For example, if they were working in our society, maybe as traders or as other form of job, people still need to go to them to buy from them for them to sustain themselves. It's very important because when we discriminate against them, it's going to add more to their problems. It's going to add more to their problems. They're going to have mental breakdowns. They might even commit suicides in the end because they are saying everybody in the society is seeing me differently. So people should understand that COVID-19. If you recover from COVID-19, people should not discriminate against you.
That's good. Sadio, can you have, yes?
I would like to talk a little about that anyway. I think the issues regarding stigma and discrimination, which can likely occur in this issue of COVID-19, is so intense, especially in our Gambian context. Take it from the angle of healthcare workers. If you associate with people who come into the country, those we send in for quarantine for the 14 days period, as long as you work in that front line, that response team, it's difficult for you to come back to people and associate with them because they will think the reason why you quarantine those people is because you don't know their status. So probably someone out of those people could have infected you unknown to you and no one knows yet. So that's difficult, and if you sideline these people, we are social beings as human beings. So we are meant to socialize, we are meant to be connected, to be in contact with our family, friends, and relatives. So isolating one person because of the effect of a disorder or a disease, an outbreak, which no one really is immune to. There are a whole lot of misinformation being sent out in the media to say black people are not dying from this, or younger age people. But actually, it's been seen in all over the world, some 30, 40, 50 years of age are being killed by the effect of this coronavirus. So there's no certainty to say a particular group of people might not have. And when someone has this disease or someone has gone for tests to understand their status, that doesn't necessarily mean that if they're declared negative or off from the treatment because they're negative in the test, they don't have the infection anymore. That's why they are being sent home. If they had got the infection, they would have been asked to isolate themselves, not to come into the public, or to be treated wherever treatment center they had done the test. So people need to understand this. As far as COVID-19 is concerned, we need to be supportive and come together. This is a time when we need to be together to help each other, because not every one of us is strong enough to take care of all of our needs. So we need to be there for ourselves and as much as we can do to help other people around our vicinity.
That is true. We'll come to Fat Jallo. Later we'll come back to Sadio, of course. Fat Jallo, what is the Office of Mental Health Promotion doing about this coronavirus in relation to the mental health issue in the Gambia?
Okay, thank you very much, Mr. Ba, for that question. At the Mental Health Program Office, like I know we have a task force that is dealing with this coronavirus, the response team, we call them. So in this response team, we have a subcommittee called the Psychosocial Subcommittee. So the Mental Health Program Officer, like the one who is the Mental Health Program Office for the Gambia, he made up a committee made up of different healthcare professionals that deals with the mental health of people. Let's say we have psychologists there, we have social workers, then we have mental health psychiatric nurses as well. So this group, they are there to help people in dealing with the COVID-19 mentally. So when we have people at the quarantine centers, like we have these mental health workers that go there and support them psychosocially. Because as when you come into the country, you just drop from the airport, they take you to a quarantine center, that's going to have effect on you. So they send these nurses there. Sadio here is one of them. They go to these quarantine centers, talk to them, help them with their needs, reassure them that it's all is going to be fine. It's just like they let them see that thing as a unusual routine in their normal routine. They're not going to stay there forever. It's just for a certain period, then they're going to go back to their family. They are there so that they can protect themselves. So this group, we have them all over the country, from here up to URR. Because even when you look at in URR or other regions, we have social workers as well, and we have mental health nurses. So all of them are put into the committee, and their numbers are put into the list. So wherever you are, you call, and we see that, and they see that the thing deals with psychosocial, they will call that person that is nearer to you to go and help you psychosocially. That's what the ministry is doing right now.
That is very good.
Yes, Mr. Ba, of course I am not the information officer. But being a key figure in the mental health aspect of the Gambia, I am privileged to get in some information. As far as I know, I do understand that the Ministry of Health in the area of mental health program is doing a whole lot of activities in connection to COVID-19 to helping people regain back their consciences, to be back to themselves and to protect their mental well-being. One of those things is to decentralize services into various areas wherever the need may arise. So in the response team, each team will have at least a psychosocial support officer, being a specialist in mental health as a nurse or clinical psychologist, that will help the group to deal with psychosocial issues that may emerge at the time. And also there are vast trainings that have been programmed to come up in order to capacitize the mental health program, because It's not a very, very vibrant area globally, and the Gambia is not an exception. Not many people have ventured into mental health, so the human capacity is too little. So we're thinking of training many people in the first aid aspect to help people who might have difficulty in dealing with the occurrence of this, just to stabilize them. If they need a much more higher health need, then they'll be referred to getting that. But so far that this outbreak is concerned, we are hoping that it wouldn't get to a point where people will have a need to be admitted or to see a psychiatrist or clinical psychologist. As for now, that's what we hope, and we want to train some first aid people, Red Cross, military, and police officers to help in this aspect.
Okay, that's good. I'm still with you, Sergio. What do you think we can do for people who have depression or stress due to this coronavirus pandemic? Or what do we do for them? What can we do for them?
Okay, yes. First of all, I would like to say it's pretty much very normal for someone to be stressed when you are faced with uncertainty, something that is new and you've never seen it. That's quite normal. The difficult part is for you to accept the existence of this problem in denial. Of course, it is a normal process for people to be in denial when they are faced with a lost, grief, or something uncertain in their lives. But you need to deal with this quickly and get away to the next steps so you can continue along with your life. So being stressed over this COVID-19 because you think you might contract the infection, a family member, a friend, or whoever is a loved one you are worried over, it's natural that you be stressed, but how you deal with the stress makes the difference. Understand the existence, accept the fact that that is happening, and do the little that the healthcare workers in every region will ask you to do. The hand wash, social distancing, not to cover people or cover your mouth and nose when you cough, because you do not know who you might save. Probably you can contract this infection and it wouldn't be a bad thing to you. You can handle it, because sometimes our response to infection or whatsoever disease depends on our immune system. Maybe you are able to withstand the effect of this, but someone in your area, in your house, or in the household or neighborhood where you live has a weakened immune system, but you do not know, and he or herself don't know that. You could associate in some ways to the shop or just pass by, contract the virus from you, and you've affected that without your own knowledge. So we need to pay attention to how we deal with people and to understand the fact that this thing is happening. Quite a lot of people in the Gambia do not believe that this is a real happening in the world. And globally, we've seen people dying. There's not a time when we see people die like the number they're dying in a day, apart from this COVID-19. So one needs to think back to understand, even if you do have this suspicion to think that this is a conspiracy, but if you see people dying all over the world in thousands and thousands of numbers, that should click something into your mind to understand that I need to listen to what I'm hearing from the healthcare workers, because so far now we do know, or the only people that can help you out is those who have the first-hand knowledge into this aspect, and those are the healthcare workers. So listen to the information that is coming from credible information sources. Do what you are asked to do. Stay healthy. Drink a lot of water. Do not get too much information. As a healthcare worker, get the rest when you need to get the rest. Sleep if you have to. Eat healthy, drink plenty. Do understand that you cannot change everything, and do accept the fact that you will see people dying. And if they die, you cannot do anything. You need to move on in order for you to be able to help other people. If you stay in those living conditions, in denial that you cannot move, some other people will die again. So instead of you wasting that moment, move ahead and help people that you can help. That's what is of key importance in this aspect.
Fadjala, you want to add something? Yeah.
Okay, like also, sometimes, as Haji said, it's normal to worry. Like, nobody can be worry-free. I don't think that's possible. So it depends on how severe it is. So when you are stressed or when you're depressed until it is severe, like the person that is trained to assess you, maybe be a social worker, a psychologist, or a mental health nurse, when the person assesses you and see that actually your this depression or your distress is out of proportion, is severe or is moderate, they will write or they will refer you to seek higher help, maybe to a psychiatric go to a psychologist for you to receive more help, because maybe where they are, they can't render you all the service that you need at that point, because your depression or your stress is out of proportion. That is also very important. Health workers, when they go to assess people and see that this person, the depression or the stress is out of hand, they need to do the necessary referrals so that you can get the help that you need at that moment. Yeah.
That's right. Still on this psychological effects, we know too much of information can certainly affect the mental well-being of a person. Now, right now, I referred earlier to the contradictory information that we receive. Of course, when we listen to the WHO or the Ministry of Health, we get reliable information. But out there on social media, on WhatsApp, and even on the streets, you hear a lot of stories about coronavirus. Some will tell you that taking garlic will solve it. Some will tell you that if you drink a particular concoction, it will help. You know, so many things at the same time coming to the individual. How do we prevent ourselves from, going bananas out of this, if you like?
Yes, Mr. Ba, it's actually fair to feel all the fear that you need to feel when you hear of all this confusing information being thrown at you. Whether you get them from the social media, from the news on the radio or television. Actually, be it garlic or bitter cola, whatsoever fruits they might have mentioned to help in the prevention of COVID-19 might not necessarily have a scientific-based background to say this is the reason why you should take it to help yourself prevent from. But of course, all of these are good and help our immune system to stay strong and to stay healthy. Getting enough of vitamins from fruits, vegetables, and other minerals will do no harm to you, even in the context of this COVID-19, because you don't know if you're going to contract this or not. We need to strengthen our immune system to get ready for the attack should we get into that. But you might not have control over people giving information on the street or talking about on the social media, sending any kind of information they come across. But what makes the difference is to stay strong and to understand that you have a source where you pick your information. So anything that comes and contradicts that reliable source of yours, you do not want to pay attention to that. You want to send that off in the rubbish bag or wherever you think you can dump it to, and stay focused on to where you do get your reliable information. Yeah, a whole lot of issues will come up because this is a new occurrence and there's no one who knows what is happening. Everyone is trying to understand what really is going on so we can handle this. So let's be realistic and understand that this is happening. People will die. I may die, some other person may die. But let's understand what to do at a time and get information from the sources where we trust best.
That's right, yes, Madam.
Okay, yeah. Because like when you look at it, as I say, you cannot avoid rumors. Even when they don't have basis, they're just going to post it there and cause panic in people. So I think mostly in countries, I don't know, maybe in most countries, what they do is try to come up with a board or team that does rumor management. I know here it's happening because like part of the subcommittee I am in, they're trying to bring in people that does rumor management, like how to manage rumors. Because some people, whatever they hear, that's what they're going to believe, because they are fearful or they are in panic. Whatever they hear that will help them not to die per se, they will do it. So they are trying, the committees are trying to bring up these people that will do rumor management. Like when a rumor is out, they will know how to manage it. That will help us very well in dealing with this coronavirus, because when you look at it, there are many rumors going out there. People are believing it and they are doing it. So people are, the rumors are even like, as you said, people are saying it's propaganda, and some people are believing it and they don't care, they're just in the street. So we need these people to come and do the rumor management for us to save ourselves and save the friends around us. Yeah.
I think that will be very important because I have this example when the Minister of Health announced the first registered case of coronavirus in the Gambia. That very night, the next day, I had some people talking, and someone said there's no COVID-19 in the Gambia, it's just rumors. I said, no, the minister himself made this announcement last night. The guy said, no, this morning I received an audio on WhatsApp that it is not. So I said, look at this man. The minister goes to national television and announces that it has happened, that's a case, and he is relying on a WhatsApp message to say that it doesn't. So I think that will be very important for the ministry to come up with, because there's a lot of that. And the other part is the conspiracy theories. There are a lot of conspiracy theories. For example, the assistance that has come from China, so many people are saying that it is infected with COVID-19. So all these things are contradictory, and people are getting confused. What can you tell people about that?
Yeah, I think people are overthinking about the issues. People are getting into affairs where they have no business to deal with. Because if you see we set up a Ministry of Health, Finance, and all of those, agriculture, defense, it's because we want that body to be responsible for the affairs of that aspect. So if you do not trust people, you will find it difficult to work with them. I think the people need to trust the Ministry of Health and allow them to do the job that they have been doing for quite a long time. Of course, there are a lot of time, even today, that we do not have materials which we require to do the job. Quite a lot of time, people will sacrifice to go extra mile to help people out when there are no equipment or money available. So if this money comes, which may certainly not be sufficient to take care of all the issues concerning COVID-19, it should not bring too much confusion into the people. People need to rest and understand that if the health workers or the Ministry of Health sit down and don't do what they're supposed to do, everyone is likely to suffer from this effect. And taking a step to wanting to understand the inner cycle, life of the Ministry of Health, is going beyond your boundaries. You need to stop where you need to stop and get the information rightly. There's no need for speculation, because even if you go out to say the ministry is giving the money to each individual in the ministry to put it in their pocket, that's not going to change unless there is mechanisms put in place to handle that matter. So if you have a suspicion that you are truly sure about the ministry is mismanaging, it's rather better to go to authority to lay your complaint than to sit on street and confuse every other person who have a different belief about the issues. So people need to stay up to date before you talk about the corruption or whatever mismanagement of funds. Be sure of that matter and get the right information. The street is not the right area where you need to discuss, because the street wouldn't change. The authority will do. So lay your complaint to the relevant matters. One of the key issues that people need to do to handle their stresses and depressions in this matter is to complain to people who can help. There's no point you need to complain to me if I cannot handle that situation. I'm just going to know the bad side of yours, the thing that is disturbing you, and that can extend your worries, because tomorrow you can be worrying that maybe I will tell a friend, and a friend will tell a friend. So many people will know your problem. So just lay your complaint to opposing who can solve your matters.
In other words, each should stay on their lane. Fatma Jallo, last comments, because the time is almost up. So what are your last words?
Still on that, like saying like they are allowing people to bring in materials that we know will infect those people more. So when you look at it, those people at the high authority there, they have families in the Gambia. Everybody is related. So imagine, how can some person bring in, you know that this stuff is bad for my people, and you still give it to them? I don't think people need to understand that. It doesn't make sense. I cannot have my family here and I'm the leader, and I go and bring bad stuff in the country and give it to my family. What does that tell? So people need to understand that they really need to sit and reflect really what people are saying. Is this possible? How can somebody who has all his family here bring all these defective stuff to my country and infect his own people? Yeah, people really need to think about that.
Last words, Sergio?
Yeah, I just being grateful for this wonderful privilege to be here, and thank you, Mr. Ba, for the time. Thank you to the whole community, and to the Gambian people and to the extended world. We need to be careful where we get our information from, and stay up to date. Minimize the time you spend on news, and be active, stay healthy, and do what you're asked to do by your Ministry of Health in any area you find yourself. And thank you once again. It's a pleasure to be here.
You're welcome. Thank you very much, beautiful listeners. That was all we had for you on this talk show on the coronavirus in relation to mental health and our psychological well-being. I had with me today Sadio Kamara and Fatmata Jallo. Until we come your way next time, I have been your host, Musaba. Assalamu alaikum wa rahmatullahi wa barakatuhu.